Good morning, everybody. Good morning, ladies and gentlemen. Welcome to the first masterclass of ACE 2024. I'm here together with my esteemed colleague, Sarha Courtnay, and together...
Got me? Are we on?
Are we on with Sarha? Yes.
We're here? Yeah, perfect.
Fantastic. Sarha and I are here together to share with you a very exciting event, the launch of what I feel is the finest, most refined radio frequency platform that I have ever used in my practice and my practices in over the last 15 years in my career. And we're excited to launch this here in the UK with you today. And this is EXION. So we have a lot to cover today. So if you have any questions, feel free to save them right till the end of the presentation. And we will be also at the BTL stand later today at 11 o'clock to kick off with a champagne reception. So come and join us there today. Thank you very much. So this is really exciting because today is day one. And you are here to learn, to be educated, together with Sarha and I, on the very latest platform to treat the skin on the face and the body, 23 different indications, one platform, 4 separate handpieces. So this is the official launch of not one device, but we're actually launching 4 devices here with you. It just comes in one platform. I'm Sherina Balaratnam. I'm a former plastic reconstructive surgeon from the NHS, specializing in burns predominantly, as well as skin oncology. So I love the regenerative side of what I do, and this is exactly what EXION brings into my practice. Half of my career in plastic surgery, the other half now in regenerative medicine. I have spoken for a number of companies, and it's because I love what I do and I do exactly what I love. Injectables, topicals, energy-based devices, they all come together in my practice. I'm based in Beaconsfield, Buckinghamshire. My practice is called S-Thetics. My amazing team that carry out many of the treatments are here today. And what I love is bringing them all together in treatment blending. And I love the regenerative side of the science of aging. A little bit about Sarha Courtnay, who's going to share with you as well.
Thank you very much, Sherina. So my name is Sarha Courtnay. I'm 8 years in aesthetics now. Very different background to Sherina. It's actually business development, branding and commercial strategy. I am the first one medic for KOL for BTL, and our clinic is Advante, and we are based in Jersey Channel Islands along with my medical director, Dr. Alexa, who is sat here today with us. My speciality is very much more the commercial device-led technology, and we are also a full BTL clinic. So we actually have, there's a clicking, there we go. So our clinic is here. We are based on this lovely, beautiful beach. Doesn't always look like that, but when the summer is, it's there. We have the entire BTL portfolio, so we have all the M suite, and then along with Dr. Alexa doing the injectables and skin boosters, we kind of offer the full package there for our clients. For me, there really was a no-brainer when coming to partnering with a device company. BTL, I've worked with them since the 2018 M-Sculpt launch, yes. When I first met Sherina as well. And then when opening my own clinic, which has only been open a year, that was a no-brainer for me with working with this amazing company. So, you pass that on.
Thank you, Sarha. Don't you just love that beach? I could look out that window every day. So very similar to Sarha, we both come from different backgrounds, but we have shared vision and shared passion to deliver results that our patients can see, feel, track, measure, and celebrate every single day. So specializing in treatments for the skin, face, scalp, and the body, it came into body sculpting in 2018 that I was looking for the best. And what was the best? M-Sculpt back then. So I have now a 5-year legacy working across many different platforms of the BTL devices. Why did I choose them? I buy because I believe in the products. I believe in the science. I believe in the data, the publications, key opinion leaders from across the pond that have spent many years in investigating these devices. So from the very first M-Sculpt in 2018, we got results, and our patients could see muscle stimulation, building new cells. We're not just creating tightening treatments, we're creating regenerative treatments that are building new cells. So across the platform, I've also watched the product innovation just continue to grow from strength to strength. From 2018 to 2019 to 2020, post-lockdown, the integration of radio frequency together with M-Sculpt brought together M-Sculpt Neo. And we saw our results just literally grow from strength to strength to treat the muscles of the body. And then M-Cellar for pelvic floor, and then moving swiftly on into launches with M-Sculpt for the flank area, and then followed by finally the face. And I remember in 2018 saying to the team then, when you create something for the face, I just want to have it. And here we are. And it's not been that long, since November 2022, and now to last year in January came the launch of EXION. And we're really excited that we're able to share with you our 6 months of data on how we've pulled together all of these treatments into both of our practices to get us to where we are here today. So EXION has this space in my practice. It sits right bang in the middle, and Sarah's going to take you through the business side of things, because that's really key. As plastic surgeons, we want to do facelifts and we want to do reconstructive or aesthetic surgery, but this treatment builds beautifully around that because it treats skin quality. And then in using topicals to really enhance the delivery of the results, all the way across the energy-based devices, light therapeutic devices, as well as with laser technologies, we can really use this to define. But why did I really love the concept of investing in BTL technologies? It wasn't something new for me. I'd heard about the legacy of BTL for over 30 years. 30 years I left the country. I'd heard about it in passing from the world of physiotherapy, but I didn't pay much notice to it because that wasn't my remit back then. But 30 years of legacy in treating muscles, in investing in science, 400 people in R&D. That is a lot of research that's gone into the creation and innovation and the scientific evaluation of these products. Moving swiftly along 30 years from physiotherapy, cardiology, pulmonary, and then emerging in 2011 with one of their premium radiofrequency platforms. So that is 13 years ago. And then moving swiftly along from body sculpting to face tightening, and now onto EXION. So think about this radiofrequency that's been around since 2011, but now they've integrated some new things that have brought together the launch of EXION. And Sarah and I are going to go through its unique points here today. So this is what makes EXION really special. And I'd love for you to come down and have a look at it later, because it is one platform and you've got these 4 handpieces that can ultimately do everything you need to treat the skin on the face and the skin on the body for your patients, as well as intimate wellness. We have breakthrough radiofrequency needling, and many of you are probably familiar with radiofrequency needling procedures, but this one has some very unique points. And then finally, the next thing, which is autologous therapies. We are in the field of regenerative medicine. We're supplementing our patients with hyaluronic acid. We're injecting them with hyaluronic acid. We drink hyaluronic acid, but have we ever been able to upregulate the body's own cells to produce hyaluronic acid? Not until now, and we can do that with EXION. And then Sarah's going to take us through the body treatment as well as for intimate wellness. And these are some of the fastest treatments I've ever known to date. So this is EXION, 4-in-1, a lot of science, a lot of data, a lot of precision, and a lot of punch. And I'm going to take you through the first one right now, because with all of these, I have it in one device. I'm going to share with you the first one I started using when I brought this into my clinic in 6 months ago, and this is EXION Face. EXION Face is 100% non-invasive, and for those of you who have used non-invasive technologies using radiofrequency, we know that it targets the skin, the dermis, to upregulate collagen and elastin proceeding. We've been using radiofrequency for years now, from generation 1 in 2010, and we've been seeing results that we can believe in. But this is very unique because it stimulates the body's own hyaluronic acid. We lose 1% of hyaluronic acid, not beyond the age of 25 to 35, but we start losing it from birth. So we should really start thinking about the ways of autologously upregulating our own hyaluronic acid, because see how much it drops once we get into menopausal years and beyond. Hyaluronic acid, as we know, is critical for stimulating growth, because we need it for cell function, but also very critical for anti-aging as well as for youthfulness. So aside from topicals, injectables, this is the only way that we've been able to see up until now a device that upregulates your own. How does it do that? Now, this is a monopolar device, so you have a grounding pad attached to your back, and the radiofrequency goes through using gel onto the skin. Take, for example, the face. And when you use this across the entire skin dermal layer, it releases this beautiful homogeneous feel, like a hot stone massage on your face, that stimulates the dermis to upregulate the body's own collagen and elastin production. So that is a thermal effect. But moving across to another bit, now BTL have incorporated and synergized targeted ultrasound therapy. So what does that ultrasound therapy do? It creates a mechanical stress to the fibroblast at the reticular layer. So very precise, and it is this mechanical stress that upregulates the body's own hyaluronic acid production. We can see it in abundance of clinical trials. So there are a lot of studies here that show almost a 224 upregulation in HA, both on in vitro and in histology. And one other critical thing that I've never experienced before is a significant increase in elastin production. We've been able to stimulate collagen for years. We've been doing it pretty well, but we've never been able to stimulate that protein that improves the stretchiness of our skin to this level up until now. So two things I want you to take home with you today is the upregulation of HA and the upregulation of elastin to date. Many patients have been trialed. These studies go back to 2021, so years have gone into the creation of this platform in order to synchronize all 4 handpieces to date. And as you can see from the image to the left and the right, it's beyond the tightening. You see improved cell renewal, you see improved hydration, improved elasticity, and the studies by Dr. Yael Halas and Sunil Chirukuri show an increase in your own hyaluronic acid of up to 23%, and that's significant. Look at the tightening around the perioral area, periorbital area. And I'm going to talk about the perioral area because you can use it around the lip and the perioral area too. So take that result and just pretend that it's happening to the lower face, because this is what we're seeing in our patients every day. But look at the age of the patient. This is someone who's a little bit more aged and aging, and they still also respond very, very, very well. Crepiness of the skin on the face also extends down to the neck. So for me, the face starts here and finishes down here. This is a common presentation with our patients, and they really want improvements, sometimes also non-invasively. Many patients say, what if I just have 1? Or what if I just have 2? So this is a quick photograph of a patient of mine who's had 2 treatments, and she's also had a little bit of M-face, 2 treatments as well. But look at the eyebrow lift, because this is now a treatment that we can use for the forehead. And I've had radiofrequency devices before in the past, and I've never been able to treat the forehead quite so well up until now. This is one of my first patients that I treated with 4 sessions of M-face, but this is just her after 2 sessions of M-face together with EXION. Think about the synchronization of all of these platforms and the immediate tightening that you can get in just a few weeks. It is the fastest treatment that I've ever brought into my clinic, and the patients are just so delighted with their results so far.
Thank you, Sherina. So moving on to the next handpiece is the EXION body, which we'll touch upon on some stats shortly, but this is actually, and it was interesting, we were comparing last night, Sherina, weren't we, as to what we're seeing lead in our clinics. And for us, the EXION body is running daily, back to back, and the results we are getting is absolutely superb. So BTL, they did shake the aesthetic industry by introducing the M-Sculpt back in 2018. And what I will say is not only getting credited for winning every award possible in the non-invasive body contouring market, the press that BTL generates, we have patients calling us constantly, not asking, okay, I want fat reduction or I want XYZ. They'll call and say, I want the M-Sculpt Neo. I want the M-Face, and now we're seeing the EXION as well. So it's that brand awareness that we are getting with this company. It's known, patients know it, and they're calling for it. So touching on what Sherina said before, we've seen the journey and how the company has grown over the years. Anyone got the Exilis in the room, in their clinics right now? Fantastic. So we had the Exilis, the predecessor to the EXION, and best thing I can say is upgrade and get the EXION. It's phenomenal, and we're going to find out more why now. So the EXION body for the skin. We say it's a 4-in-1 platform, but I actually like to say it's almost a 5-in-1 platform, because the EXION body can treat 2 things. It treats skin laxity, and we can also treat fat in those hard, stubborn reach-to-reach areas. Same technology with the monopolar RF and the targeted ultrasound. We are seeing an improvement with skin laxity of 85% on average. The Exilis was 35%. So where we've taken the technology from the original data to where we are now is huge. Moving on to the fat, we're seeing on average a 22% fat reduction in hard to reach areas. We achieve this by being able to use the built-in active cooling areas as well, to be able to reach those subdermal layers and treat those really hard to reach areas. So your saddlebags, these little pockets here, inner thigh, we're seeing fantastic results with this. Again, BTL are renowned for their clinical studies and providing the data to show the efficacy of the treatments. We can see the fat reduction here, 22% fat reduction, 87% overall improvements, with 83% of the patients at the 3-month follow-up reporting that reduction of fat deposits in the treated area. Skin laxity. This is something that we see day to day in clinic over and over and over again. We have our demographics 45 to 65, but we do get a lot of the young postpartum mums coming through that see that laxity in the stomach. And this is what's great with the EXION, we'll touch on shortly, is the combination of treatments. We treat with the M-Sculpt Neo to be able to work on that diastasis and improve that conditioning. And then we'll come in with the skin tightening to be able to treat that skin laxity, lift the belly button and help with that crepiness. Although we are saying optimal results for 3 months post-treatment, many of my patients, particularly with the body, they'll see the difference in the skin quality at that halfway through the treatment. They'll be like, look, I'm pushing my skin together and I've not got that crepey appearance anymore. So we're really seeing some fantastic results with a 96% satisfaction rate for skin laxity. That's huge for us. And also, I'm yet to have a patient that's not happy. They have one area done and then they're like, oh, okay, we'll move on to the back of my thighs or my inner thighs. It's a constant recurrent revenue, this device, for our practice. So we can see some of the before and afters from BTL. This one to me, inner thigh, but this looks like a combination of fat reduction and also some skin tightening that we can see on the inner thigh there. This is one of my patients. This was at actually 5 months follow-up on treating skin laxity. Look at the difference in the belly button and the lift that we've seen there. It's absolutely astronomical. Patients are coming back through going, yeah, I've seen a difference. And they'll say they feel the difference, but then we show them the pictures. And even myself, we read the trials, don't we? We read the papers, we see the before and afters. But when they start coming through your clinic and you're seeing the results you're getting, we've been absolutely blown away by this device. Again, the knees, this is actually a mix, and this was taken immediately after the patient's last treatments. So she's yet to actually come back in for her 3-month follow-up. This is immediately after, and we can see in particular the right knee how much she's seen that improvement. She is currently spends half her time in Jersey and half her time in Barbados. So she has called and checked in and told me that her knees are doing very well, and yes, she's wearing SPF on her knees. So I'll pass you back to Sherina to talk about the fractional RF.
Thank you very much, Sarah. And Sarah's got some amazing before and afters to follow on, so don't go away. What I want to add into that is this very, very beautiful evolution of the technology, not just radio frequency, but with targeted ultrasound. So you can see from Sarah's results, her results are actually happening faster. When the body produces its own hyaluronic acid, everything speeds up. So this is why we're getting results faster than we've ever seen before. Does anybody here use any microneedling devices with radiofrequency? Hands up. Couple. Excellent. Okay, so there's some of you who are actually familiar with fractional radiofrequency needling and some of you who might not be. So these are technologies that have been around for some time now. And with that comes generation 1, generation 2, and then now we have something like EXION, RF needling. What I want to say about radiofrequency needling, when I go back to when I first started using it in 2012, they were the first of its kind. So because they were the first of its kind, everything was in a new stage. But whenever we injure the skin using the wound healing pathway, we can understand that the first thing the wound needs to do is heal. So there is an inflammatory response. There is a histamine response. What happens with the histamine response? We get flush, we get red. There's a little bit of swelling. We get a histamine response. So naturally, we get a little bit of pain. There's a little bit of discomfort as well. So that's if we naturally cut ourselves. So what if we artificially, exogenously induce that trauma? And that is essentially what radiofrequency microneedling in, a controlled trauma into the skin. Why do we do that with people? Because we want to create an inflammatory response, not the bad one that causes the pain and the downtime, but we want the good stuff, that collagen, that elastin production, the one that gives us the tightening, the one that gives us the glow. So this is what we're aiming for. However, this is one of the challenges of microneedling radiofrequency can do. And unfortunately, when you Google, and I did a Google search last night, not on EXION, but just on microneedling radiofrequency, and these are some of the things that came up. 2-star reviews on RailSelf, all the negative complications on former devices, on old devices, devices that we probably never even have heard of. My face is lobster red. I had welts and burns. There are photos all over the internet. They are scary. There's lots of unregulated things out there. It is a frightening space for the consumer when they do a Google search. So these are the things that have to be borne in mind as business owners, as clinic owners, as practitioners, as well as device manufacturers. We want good quality training. We want great quality treatments that our patients are going to feel safe. They're going to get great results. But also very, very importantly now, you want a great experience. You want them to heal faster as well. Let's take a look at topical anesthesia, why people experience pain. We use topical anesthesia every day in our clinic, specifically with my previous devices with microneedling RF. However, the patients say, I can still feel that. And time again, session 1, session 2, session 3, and they still say, I don't enjoy the procedure particularly, but oh my gosh, I love the results that it gives me. So guess what they do? They grin and bear it. And if there's one person in the planet that can get through 1,000 microneedles, it is Cheryl Marshall-Williams over here, who's probably been doing this for 11 years. So when EXION RF needling came along, I wanted to know what is it about this device that is going to be so special, so unique, and be able to give me a procedure with EXION RF needling last April, and I had absolutely no numbing cream. It's because of artificial intelligence brought into the device that could be so precise and so specific so that every single needle is not just going through the skin as a whole and delivering the same pulse and the same energy and the same power. They are all working independently of each other. Because this might be a sebaceous area, but the other area may not be. One might have a chickenpox scar, but the area beside it might not do. So every single needle is working in absolute precision, dancing to each other with dynamic impedance technology to give the skin exactly what it needs. And that's why I don't need the topical anesthesia so much in my clinic anymore, which has reduced procedure time. It has also reduced the amount of time in my practice, and therefore easier for the reception team, easier for the practitioner team, easier for the business. So this is why we're actually seeing no numbing or very little numbing. Sometimes when we use longer needles, yes, we might need more numbing. But you can see from clinical papers, you need to keep a patient in clinic for 1 hour to get to 1 millimeter depth of penetration. And that is under occlusion, 2 hours, 2 millimeters, 3 hours. Your patients are not going to stay in clinic for that long. They want to go in and out fast. So this is what EXION fractional is. We use it for the skin on the face, we use it for the skin on the body. We've been using fractional RF needling for stretch marks on the body. It is uncomfortable, not until now. So there is certainly less pain, there's certainly less downtime, because for now, being so precise with AI built into it, we are able to do this in a single pass fashion. So we don't need to go through traumatized tissue over again and over again. The other thing that's very specific is because of the AI and because of the dynamic impedance technology, there's a unique extended mode built into this. Take, for example, Sarah's got some fantastic results on the skin of the leg with a scar, and she can now use the extended mode to go up to 4 millimeters using the needles, press the extended mode, and that actually shoots a further pulse of energy down a further 4 millimeters. So that is a total of 8 millimeters, 4 with needles and 4 with not needles. It bypasses all the pain receptors. You don't need to keep a patient in the clinic for 4 hours with occluded numbing cream, and she's got some beautiful results to show with that. So I just want you to take home, this is not just a radiofrequency microneedling device. This is AI, precision points, every needle working differently, an extended mode should you need it. It'll be really interesting to see where we go a little bit off piece, in maybe even to treat the submental area. So I look forward to playing around with the device a little bit more then. Does that make sense, everyone? Key features, lots of nods in the house, fantastic. So this is a summary. Extended mode off. So I use extended mode off for the eyes, the face, the cheeks, the jawline, the neck, for example. Extended mode on for body, for tightening, etc. And it is because it is precisely reading every needle point using dynamic impedance technology. There are so many clinical trials, everybody, and so many clinical studies which shows an upregulation in everything again. So think about the combination therapies. I use this in combination with EXION Face. I use this in combination with my M-Face, which I've had since November 2022. And the patients are just loving their results again and again, because you're getting now with the EXION Face, upregulation of collagen, we talked about that, upregulation of elastin significantly, the upregulation of the body's own hyaluronic acid. So guess what? Less pain, less downtime, less swelling, less everything, but more to gain. All of this, 41% improvement in scars in a short amount of time, 23% increase in hydration, more comfort, more laxity improvement, and that is literally all we want. Young patients coming to have the treatment. And some of the studies that were done in the past in the States, the treatment was done in a 14-day interval. And that's fast. We used to leave 4 to 6 weeks in order for the skin to heal, but now we don't need to do that anymore. We can use a shallower needle because it's more precise and the patients are getting their results. some of the results from the device manufacturers, beautiful result. But what I'm seeing quickly is the glow. The glow comes really fast, isn't it, Cheryl? And that is what patients see. And these are older patients, tightening, improvement in laxity, brow lift. We've never been able to see that before. My patients are presenting at the age of 78, 80 years old. She's 78 years old, never had any treatments before. And this is her after 4 M phases, and then she decided to go for the EXION at session number 2 of her M phase. And this is her just after a month. I've never been able to get these results so quickly. It normally took me 3 months to 6 months, and we're getting them in about a month. These are some of the results in her full face, and she hated her neck. And she was pretty happy with this. I was over the moon with this. Neck improvement in skin laxity, hydration, quality, and we used the Vector 3D because we wanted to show her, look, this is really, really working. And you can see this acceleration in the lift of the patient, the amount of vectoral change that we can see. She's still got a little bit of a way to go because this is only 1 month post-treatment, but you can see the posterior displacement of the skin is up to 3 millimeters lift in just 1 month. So see what happens when we go into proliferation and maturation phase, and we can also see a volume shift in the submental area. So now we're going to be looking at the submental treatment tomorrow here at ACE with the team BTL. So think about that combination therapy with your former M-phase devices to see what it can do for our patients.
Thank you, Sherina. Yeah, very exciting. Adding the fractional RF to the clinic, and really excited to share the before and afters with you, particularly with patients that have been through quite traumatic experiences. I have one lady, which we'll touch on shortly, with a horrendous car accident, and what we're achieving with the needling is absolutely blowing us away. But moving on to the MFEM. So I touched on before when we did our short intro, it has really become kind of a specialist field for myself and Dr. Alexa back in Jersey with women's intimate health. Our demographic is 45 to 65. We are seeing a lot of perimenopausal, menopausal women coming through, and it is a taboo, and we have found it has been quite difficult breaking down, talking about, vaginal health, well-being, and how we can improve that. We have the Emceller, which is a perfect gateway for these patients coming in when they're suffering with stress or urge mixed urinary incontinence. The fact that they have this chair that they can remain fully clothed on, it's non-invasive, and they're seeing phenomenal results, it opens that pathway for us to build a relationship and then start talking to them about the MFEM. However, what we have seen this week in particular, Dr. Alexa and I, is I'm not sure if anyone saw the Olivia Atwood show that's been on recently, and they actually filmed a treatment with FEM. We are now getting patients calling us off the back of that show, again with BTL and what they're doing with press and getting it out there, saying, I've seen that you do FEM, I want to come in. They are calling specifically for this treatment. Let's click going. We saw on this morning, I think it was last year, we were on this morning with the Emceller, people talking about this more. We're getting publications like Vogue picking this up with pelvic floor health. Pelvic floor health is absolutely huge. What we're trying to do now, though, is move into more of kind of the internal vaginal rejuvenation we can treat. So these are the particular conditions that we are seeing presenting in clinic. This is the figure that I was most interested in. Up to 84% of postmenopausal women are affected by GSM. This is what we're seeing day in, day out with our patients. They may come in to speak to us about skin laxity. I'm feeling that collagen loss. I'm not getting the results. I've never had injectables. This is something Sherina and I are going to talk about. We've seen a massive shift with patients not wanting to go down that route. Well, actually, we can improve this with the EXION device. From the back of that, we openly talk about what we can do for women's intimate health and well-being in the clinic. 45% of incontinent women reported the loss of intimacy. Again, this is something that we're really seeing, and we're actually doing a case study with BTL at the moment of a patient who's just been through the most horrendous journey. She stage 4 breast cancer. She's obviously all recovered in remission, been given the all clear. She had single mastectomy, ovarectomy. She's had so much that she's been through, and she's volunteered to actually talk on behalf and for BTL of her journey with the Emceller and the MFEM and how it is drastically improved not only her day-to-day life and well-being, but also her relationship with her husband and the intimacy that had completely gone before because sexual intercourse was impossible for them, and now it's not. So how do we do that? Talking obviously what we see, the changes that come with GSM, that we're seeing with the thinning of the vaginal walls, the dryness, the increase in pH, which coming on to the studies in a minute really interests me, and how we can rebalance the pH in the vagina as well. The dry and thinning of the tissues, the hypersensitivity, decreased feeling, and also the decreased pelvic floor strength and control. This is what we're seeing patients presenting with. The discomfort, the intimate problems, and also with the stress urge mixed urinary incontinence. So what makes the MFEM differently? We're seeing a figure of up to 38% of women are reporting intimate health issues. So I think we all know that's not actually the figure. The figure is probably much, much, much higher than that. And this is what we are seeing in clinic. So the MFEM is the shortest RF intimate treatment on the market. The internal treatment taking 8 minutes. That's it. And it is the most comfortable treatment to have. Patients aren't complaining of anything of heat. There's no downtime. They can return to their day-to-day activities immediately. And also what's key for me and for obviously Dr. Alexa when doing these treatments is we now have the temperature tracker to be able to support those consistent outcomes. We can absolutely guarantee that we are heating and getting to therapy, so we are going to see those results. We elevate temperature to over 40 degrees in the target tissue area, which we're then seeing an increase of perfusion, initiates the healing cascade, remodeling of the intimate area. And what we're seeing here, when we see the thickening of the tissues on the vaginal wall, we are actually supporting the urethra. So we're actually seeing patients improve with stress urinary incontinence as well. When you combine that with the Emsella, the results are absolutely outstanding. The patient satisfaction rate is huge. And we're also seeing the recurrent revenue with it as well. The Emsella, they want to maintain. So they'll come and do their course with us, and then they'll come back in at the 3-month review and say, can I go on a maintenance protocol? Can I come in every single month? And it's fantastic. We're seeing those patients come back in over and over again. We're retaining the clients with these devices. So some of the studies, as always, it is the shortest radiofrequency treatment on the market. This is fantastic for me. Look at that figure for the vaginal health improvement. That's 130% improvement with 67% sexual function improvement, based on 24 postmenopausal subjects. I think the next slide is the one that really makes me happy as well. This one, look at this stat on the third bullet point down. 83% of the patients in the group that were initially incapable were capable of sexual intercourse after treatment. We see women coming through that are with the GPs, they're really, really suffering with that kind of dryness and not capable of having intimate relations with their partner. We now can. And we have also had a patient run through the front door, haven't we, Alexa, going, I had sex with my husband for the first time without needing it, and announced it to the whole clinic, which was fantastic. But yes, this is what we are seeing with this treatment. Sherina, I will also be on the stand to talk about this because it's something that I'm very, very passionate about, and we are seeing amazing results.
I can tell, and it's really interesting hearing Sarah's passion about this, because when I started in reconstructive plastic surgery and when I came into this profession, I never thought I'll be talking about female intimate wellness, because that wasn't part of my career plan. And interestingly, 12 years ago, actually in 2011, I was welcomed by a plastic surgeon at the time who I knew very dearly, and he invited me to do CO2 resurfacing intravaginally, and it was the first of its kind. And I thought, wow, okay, let's do this. But the patients found it a little bit prickly, pretty good, but what they loved was the results. But fast forward now 12 years, they don't need to go through the prickliness, they don't need to go through the long procedure, you don't need to worry about what temperature you're possibly getting up to. Here's a device that's actually reading back to your platform to tell you that you're at 40 to 42 degrees. And the device is going to keep feeding back between the tissue and the technology to tell you you are still at 40 to 42 degrees. Cheryl and I carried out the treatment on a patient, and you could literally feel the tightening happening as you are treating in 8 minutes. It's the weirdest but most satisfying feeling in the planet. Probably for the patient too, and I know her husband that evening. So yes, this is a treatment that people come back and tell you about.
We have very happy husbands.
We have very happy husbands, and people love coming back to have the treatment because it's done really fast. And I do have a before and after to show a view of that. Lots of clinical studies, everybody. This is a platform that's been around for a while because they had to get the first platform right, the second, and then the third and the fourth in order to give you the very best. So just to summarize, you've got your HA EXION face handpiece. So you get it now. Radio frequency synchronized with the targeted ultrasound to upregulate your collagen, elastin, and finally your hyaluronic acid. Beautiful. Trials are done. Next, you have the EXION body. Sarah showed you. Radio frequency, targeted ultrasound, collagen, elastin, upregulation of the hyaluronic acid. Same again with the MFEM. Collagen, elastin, thickening of it, pushing up the urethra, hyaluronic acid, hyaluronic acid, hyaluronic acid. We've been talking about it for decades, but now we're able to get the body to make it itself. What better way to actually live your life from younger into your adulthood than to get the body to wake up? but that's important for everything from cell signaling to wound healing to post-trauma from pregnancy. You get something like this in before pregnancy, you're onto an absolute winner. So I can see where this would go far in regenerative medicine. And then finally, fractionated radiofrequency needling with dynamic impedance technology together with AI, all built in to treat younger patients in a fast treatment. And this is a fast treatment intravaginally as well, 8 minutes. So integrating EXION into my business has been easy. If anything, it's been critical because our patients needed it. Faster results that are going to be consistent, reproducible, and also measurable.
So I'm going to take a minute now to talk about integrating the EXION and how we do that. I've actually been on the road for the past few weeks with BTL doing the EXION road shows ahead of this launch, and it has been fantastic to hear the clinical team speak, Tim Taylor, the new MD as well, introduce himself across the country, and also be able to share my background, which is more the business side and how we integrate this device in and why it's been so critical to the clinic for me. So the launching clinic, got the lovely Gemma from BTL, and she delivered the device for us. We received the device back in September. So what did we do? We had obviously our existing patient database. We had our M-face patients because we know it combines beautifully with that to be able to really particularly target what we're finding is doing the periorbital area. We're getting that extra lift on top of the M-face. Our M-Sculpt Neo patients, body, skin tightening. Our M-Seller patients for sure. Our skin patients, particularly the acne scarring patients, we didn't have needling in our clinic before the EXION, and it really has seamlessly fitted in now for what we can do with skin textural improvements, particularly scarring with our patients. We obviously attack social media. Sherina and I are very passionate about social media, aren't we? We make sure that we are driving our businesses through that. And then something that I do teach a lot of into at the clinics is we host mini events regularly. We try and do one a month, and we'll speak to whether that's a new group or we will work with our patients. The great thing about these devices is patients are in for courses. So we get to know our patients, and what we do in clinic, if that one of my estheticians or myself, we start the course, we finish the course, and we make sure we get to know that patient and build those relationships and rapport with them. You then start speaking to your patients who are over the moon with their devices and the results they're getting, and say, well, we actually do events. You know, you could bring a group of your friends down. We can have some bubbles. They can try the M-Seller or the M-Sculpt because they're so easy to jump on and have little taster sessions, and we drive revenue that way. So networking and relationships, always something to drive back. You are your brand. How do you represent yourself in the community? Do you attend events? Do you immerse yourself in it? Word of mouth and referrals. We are our brand. Alexa and I constantly, everyone's like, oh, you're out all the time socializing. No, we're not. We're out. We're networking. We go out with a mission. If you're not getting a client, it's been a really poor event. So we go out always with a mission to make sure we have got someone booked in by the end of the night, whether it's consultation for devices, injectables. That's our aim and what we do. How do you represent yourself in the community as well? Think of the networking events that you can attend. Think of the Mum Club. We have a franchise in Jersey. You have the Mum Club there. This is an absolute goldmine for us as clinicians to get out of our clinic and get patients coming in. I think we're all quite guilty, or can be guilty, of staying in our clinics and thinking, well, okay, we're just going to stay in. We're not going to get out. They'll come to us. They won't. You have to get out. You have to network and go and immerse yourself in your community. The postpartum mum, they're on maternity leave. They've got a lot of time on their hands. They want to come in. They want to have treatments. People don't talk about pelvic floor when you're going through pregnancy. And this is what we're seeing with a lot of our patients going, no one told me this. This was going to happen. I sneeze, and this never happened before. Well, now we can educate those patients. Do you attend events? Black tie events, charity events, even for simple as we'll give a voucher for a charity event for a hydrofacial. It gets your brand and your logo up on those screens at those big black tie events. Get your brand out there. Again, do you partner with a charity? That's something we've actually just done. We've just partnered with Frida, which is the Jersey Women's Refuge, and it's actually helping women get back on their feet and give those women their confidence back again. We're really keen in being a part of our community and getting the word out there. Also, word of mouth and referrals. We have to have devices that deliver. Jersey's only 9 miles by 5 miles. It's a tiny, tiny little island. If we don't have devices that deliver, those patients aren't going to come. So I know that I have the right devices. I know that I'm getting results because our diary's full. We are constantly getting new clients coming through and calling, asking for these devices. So the consultation is really, really key. Understanding our patients' wants and how we work the EXION into our plan. We are the architect, the contractor, the interior designer. Patients come in and they don't always know what they want. And that's something to be aware of. They'll be like, well, I just want, how many times have you seen patients come in and go, I want this? It's one of the most common things that we see. First and foremost, M-face. Always start them, build on the foundations, and then we kind of combine this with the EXION. But it's our job to inform and educate the patients and explain what we have, what we can treat. The movement away from injectables, we were talking about this last night, we are seeing quite a shift of that kind of older clientele that may never have had anything done before. And they're like, oh, I don't want Botox. I don't want to put any of that stuff in my face. And we're seeing that quite a bit. And we're seeing that shift of patients coming to us for devices to be able to work with the hyaluronic acid, to be able to improve the appearance. And 9 times out of 10 with those patients that we get on the devices, what we then see is they trust us and then they're booking in with Dr. Alexa for injectables. These patients that never said they'd have injectables done, oh, well, I might just get my 11th done, or I might just get this done. This is what we're seeing with these devices by giving these results, building trust and getting them to become a patient for life. So why should a patient choose devices over injectables? Or should they not? For us, it works perfectly in combination together, but by offering this and being able to give this to our patients, we're opening up our doors to a whole new wave of patients that maybe we may not have had previously. So fillers, toxins and or EXION, where have you found this on, Sherina, obviously with what you've seen with your patients coming through?
Again, the same, Alexa. You know, I was just thinking about everything you said, and I was thinking about my former boss, Mr. Nigel Mercer from Bristol Plastic Surgery, and he invested in the first monopolar radiofrequency tightening device, Generation 1. And I remember thinking, why would a plastic surgeon specializing in facelifts and blepharoplasty, why would he want this kind of technology? Because everybody wants tightening. And I said, but you're tightening the patient, Mr. Mercer. And he said, there's tightening, but there's tightening, autologous tightening. So this is going back 2008. So even a plastic surgeon knew its relevance back then. And then I go back to 2007. The reason I partly left the NHS was I attended Professor Tony Chu's lecture on microneedling. And that was it. I attended, Cheryl's nodding, we attended that lecture, and it showed us what microneedling could do. And now we're looking 25 years later at regenerative therapies. This has been going on a long time. And then the speed as well. I've never had a syringe of filler yet in my life, but I've been using radiofrequency devices on my face since 2010, together with topicals, as well as with light therapeutics, Mr. Patrick Johnson at the end. So all of these things are working together with my EXION face, with my EXION body. I haven't had the intimate wellness one yet, but all of them are working. I will try it. She will challenge me and I will get there. But all of these are working in synchrony with each other. Does that make sense, everybody? So that our patients who are not ready for injectables, there are some patients that just aren't ready.
But
so
by
you
building
can
the trust.
Build the trust.
That's what we're seeing.
4 R's, I say to my team. Get the results that you can see, feel, track, measure, celebrate. That builds your reputation in the clinic with your patients, with your team, because they're going to be picking up the phones. They're going to be cross-referring over to you together with your esthetician team. And when you get your reputation in your team, they can share it with the outside world and with social media. Once you get both, the results, reputation, you get the retention. And that's really key. And then finally, you get the revenue. The money comes last, but it's critical because then you can reinvest it in fine technologies like this. 9 years ago, I invested in the first platform, and 9 years later, I now have the finest and the best. And so, no, it hasn't replaced my toxins because now I can be more accurate in its position. But what it does is it blends perfectly with everything that I've believed in since 2007.
I couldn't agree more. That's very much what we tell our patients as well. It's not a one size is going to fit everything and this is going to fix it. It's like, no, we come from different approaches. Skincare, light therapy, devices, injectables, to be able to look at it from a 360 angle, to be able to give our patients what they want to achieve. Patient selection is absolutely critical as well. I think understanding your patient's wants and needs. If you have a patient coming in that's never done anything to their face, never worn SPF, smoked, drank, and they're really struggling and they come in and they're 70 and they go, okay, I want to rewind the clock 20 years. Okay, well, that's going to take a little bit. So don't never overpromise to your patients. Understand your patients and know what it's going to take to achieve those results with them. Also, listen to your patients during the consultation. The 3 months versus instant gratification. Does a patient want a quick fix? Do they want to come in and have a full face rejuvenation with filler? Because they haven't got the time, they want to go out, they want to look done, and they're good to go and set. Jersey, we do have some patients that come through and do want that, but it's also everyone knows everyone. So people don't want to know what everyone's having done. So they'll be like, I don't want anyone to notice that I've had X, Y, Z done. This is where these devices come in beautifully, because we are seeing the results improve gradually, and with the optimal results being at 3 months. Patients are saying that their friends are going, you look great. What have you had? You look, have you been away? What's different? And that's the goal that one of our patients are looking for. And then obviously the recurrent revenue. The devices themselves speak for themselves, but the EXION being, we say it's a 4-in-1. I do like to say it's a 5-in-1 with what we can do with the body by addressing skin and the fat as well. It's not taking up much space in my clinic. I've got all these options that I can treat my patients with, and it's all in one device. But then when we combine it with other devices, that's where obviously the real beauty does come through for us. So this is just some of when we were speaking as well, the combinations that we're using in clinic to get superior results. Also the lymphostim. Sherina and I both love the lymphostim. So this patient has had Emsculpt Neo. She's also had the skin tightening on her abdomen as well. And then we pop her on the lymphostim because we get all those toxins and lymph draining as well while she's having M-Face. Big fan of the clinic, this patient, as you can tell. But we are mixing and maximising the revenue with our patients with these devices and delivering. Something on the bottom as well that both Alexa and I are very, very passionate about is the mixing of, we personally use polynucleotides with the fractional RF. And some of the results, which I'm going to go on to in a minute, have absolutely blown our minds. It's regenerative medicine. We are regenerating, we're healing naturally. The importance of before and after images. It takes time, but it makes the time to do it. You need these images to be able to share during your consultations. Difficult to get your patients to allow you to share them online sometimes, but we normally find when patients are really happy with the results, they may let us share them in theatre. And also, these patients have been very kind and said that I could use them for this conference today. So this is one of my patients who is M-Face and EXION combined. So we started, she came to us back in June last year. She'd never had anything and was a patient going, I don't want injectables. I've never had anything done. I don't want it. Fine. Big concern for her was around her eyes, seeing she said she felt tired here, and she's like, what can I do for it? We had the M-Face at the time and we had the Exilis. So we started with the M-Face because that's where she wanted to start to build the trust with us. We did a course of 4 M-Face for her, and then she came back in October once we had the EXION, and I had told her we will need to look at treating the eyes separately if that is your concern. Being upfront with your patients and explaining the journey to them. This was at her 3-month follow-up after having EXION. So we're months and months later from M-Face, and this being her 3-month follow-up for EXION with the periorbital area, treating the forehead. You can't quite make out on here, but even the line reduction that we've seen in the forehead is huge. The lift to the brow, under the eyes that we've seen here, she is over the moon. And she came in saying to me, it's been Christmas, I put weight on. And she's actually put just under, I think it's about half a stone, over half a stone on. And she's like, oh, I'm really worried about my pictures because I put weight on, it's going to be on my face. Look how much younger she looks and slimmer. And if we go through the journey before, this was immediately after her last EXION on her eyes, and then again at her 3-month. She's over the moon, she's a patient for life, she's now booking in for Hydrotype, we do hydrofacials and the EXION add-on at the same time. She's coming in every quarter for that. She's now on skincare. We're not losing this patient. This one being saddlebags. So we can see the reduction on the fat reduction on the saddlebag. Patient, again, thrilled. We have now moved on to treating banana roll and down the back of the thighs with the EXION body to help with cellulite and the appearance and improvement of the skin tone and texture. She's also booked in to have her stomach done as well. So again, recurrent revenue. We saw the knees before. This was actually a mix. We started with the Exilis. We did the first 2 treatments with the Exilis and then moved on to finish the course with the EXION. And I'm very excited to share her images once she finally comes back from Barbados to do that for me. Again, another patient with Emsculpt Neo and EXION body. So you can treat this in the same appointment. You can do the Emsculpt Neo and then go immediately on with skin tightening afterwards. We find some patients want to do the Emsculpt Neo, finish the course, see the result, and then move on. That's fine. They're coming in monthly. They're coming in. The recurrent revenue's there. The lift on the belly button that we've seen, this is where we're seeing it on the body massively, is that pull up on here and that kind of crepiness and laxity that a lot of postpartum mums get. They're being blown away by the results on their stomachs. Come on. Come on. Guys.
So we're good.
Point it somewhere else.
Click to the computer. Let's see if that works.
There we go. So again, seeing the reduction from the side profile as well. Again, this was the patient that we saw previously from the side profile, M-Sculpt Neo back in last summer, and then treating in September with the EXION for skin tightening and reduction. Blown away by the results. And that lift on the belly button for me is just, everyone's saying to us, we're of the age where everyone had belly button piercings done. And everyone's saying, I'm seeing my belly button piercing coming back. I'm like, yes, great. There we go. So this patient was EXION face, treating periorbital area alone. So we can see the massive reduction in the crow's feet. We've even seen a slight lessening on the nasal labial folds as well, with pulling up just on that beautiful kind of restoring. She's never had anything done before, but the lift even we're seeing here, over the moon. A patient doesn't want toxin, and she is happy doing this, and she wants to come in for further treatments with us. The journey that we went on, starting immediately after her last EXION face treatment and where we're at the 3-month review. She feels brighter, she feels fresher, her eyes feel more open to her, and she feels more awake. Doesn't want to work.
I think it just likes your results too much.
This
is a fantastic result. And, you know, I think gone are the days of all of us just treating a single area, whether it's injecting into a temple or using toxin on the periorbital area. We literally are looking at global changes, aren't we, Sarah?
Yes, we are. This is one of my favourite results that we have seen. And I have these on my phone if anyone's coming to the stand that would like to see them close up with the images being better. Where the patient started, this was back in 2015, the scar. She had a horrendous car accident. Her car flipped, the window was open, her arm was out the window. She completely sheathed her arm. What they've done, both sides of the legs, they took skin grafts and they've been rebuilding her arm off the back of this. So this is where we've actually started with the patient. She's not finished her course, she's halfway through. These images, the middle one was after 1 EXION and one session of polynucleotides. This is after 2 EXIONs and just still the 1 polynucleotides. If you can make out on this screen the reduction that we're seeing in particularly this area and how the scar is fading, even just feeling it, it is so much smoother. This lady hasn't worn a bikini since 2015. She now will wear a bikini. She actually has joined, she's actually become a really good friend of the clinic, and she's joined us going out regularly, and we've started doing Pilates on a Sunday, haven't we, Alexa? It's like a whole little clinic club goes to do Pilates on a Sunday. She's not posted on her Instagram since 2015. She reshared the story of our picture altogether, and that was her first post since 2015 because of the confidence we are giving these patients with the regenerative medicine and what we're achieving. Again, we're next going to start moving on to her arm and treating that as well. Just touching on, again, people are naming the device, and this is something that's massive for us, is that patients are actually naming the EXION. It's becoming a brand. It's not even launched yet, and patients are asking us about it. We're seeing it in the press. We're seeing the results. We're seeing the brand awareness coming through. And then it's something to finish this part off, the stats. This was really interesting for me. We have sold over circa 80 courses of the EXION since September until the end of February. That is huge for us. And I've pulled some stats from our CRM system as well. The EXION's the market leader. This device is running every single day, whether we're doing fat reduction, skin tightening, scarring, intimate health and well-being. This device has just seamlessly moved into the clinic and is working every day. It doesn't seem to be medical. Your estheticians can do it. Obviously, we have Dr. Alexa who will do the needling and also the intimate health as well. It's running continuously, and it's our most popular by far in clinic at the moment.
And I would thank you very much, Sarah. And I would concur that as well. And I can look at my 2 patient coordinators right in the front here, and I know that this device is running till 9 o'clock at night when we are open, because the amount of cross-referred that you get across all 4 handpieces. So think of your investment as not just this is just one platform. You're literally getting 4 platforms just built into one. Then your patients just love the results. And because they love the results, they literally come to the front desk with my esthetician and they say, well, you know, we've just had a conversation and I'd like to add on this area and I'd like to add on that area. So I've never had before, apart from M-Sculpt Neo, where an add-on was happening over and over and over again. And very similar with this patient. She first started coming to see us and she's 54, never had anything before, out of the blue. We put her on topical skincare, a couple of high-tech facials, just to build her slowly into that treatment ladder, get her comfortable and trusted in us. And then she decided to have M-Face at our launch event. So I cannot stress the importance as well as launch and in-clinic educational events with the BTL team. And here was her with M-Face, and she loved the feeling of M-Face, came downstairs, saw the EXION device, completely got radio frequency because we talked about the brand, its evolution, its innovations, and she bought into it. I don't use the word cross-sell, I use the words cross-refer. And if you just look at this global tightening that you just get through every single square inch of skin, and you don't necessarily get that with a facial filler, you get that for contour, for foundation things, but this improvement that she will continue to see time and time again are going to be exquisite. So I always say it's like a gift that keeps giving, this treatment. People say how long it's going to last, and I don't say just going to do this and it's going to taper off. I say you'll get the trigger, but if you can imagine the wound healing cascade, you get the results continuously to come. This is my first M-Face patient who then went on to EXION Face, and she uses skincare, and she has an at-home light device that we have in the clinic, and she uses it consistently, and that's just after 2 M-Face sessions. But the improvements in hyaluronic acid autologously by EXION as a whole platform, I cannot stress, because that self-made progression in HA does so much for cell signaling, and it continues, and it builds, and it accelerates. So the tightening, the refinement, the contouring that we're seeing with patients time and time again, that vertical lift, the lateral lift, the posterior lift, the patients can see it. It's up to a 3 millimeter of improvement. And that is very, very strong. It's a very, very significant change in a short space of time, up to 2.6, 2.7 millimeters of change happening using Vector 3D. So clinical photography is key, everybody. You've got to take not just good clinical photography, you've got to take great clinical photography. And this is what I mean. This was our case study patient. Cheryl and I treated her 8 minutes of intimate wellness, internal treatment. You can't see that result. But the beauty about this is for the first time, and I've never been able to treat externally, and we did the treatment together, and this was her result. She took the picture of herself with her phone, so she was in control of it. But if you can see, everything has tightened, everything looks a little bit more tucked in. And I never realized, and I speak to my plastic surgical friends now, labiaplasty is such a common procedure. It is traumatic for a lady for intimate wellness, and the patients just love this treatment. And I think you and I can concur that this treatment is literally going off every single day in our practice. From the skin on the face to the body, 23 different areas you can treat. Perioral, lips on its own, for someone who doesn't really want anything doing. But what impresses me also is that I can use it on the forehead. Our brows are descending. We are actually going lower. We're getting browtosis as we naturally age. So we can't use as much toxin anymore in our patients who are above their 50s and 60s. This is where M-Face comes in to stimulate the muscle. This is where EXION Face and needling comes in to refine the skin. And both of us are seeing this brow lift, which makes it highly versatile in our practice. A great return on investment, great for retention, great for cross-level, and I can also delegate it to the rest of our team. So a little bit of buzz about the EXION.
Again, we've touched on this very, very briefly before, but the EXION buzz is huge. This is the press coverage that BTL have actually got so far. This is why we have patients calling us asking us about the EXION and not just what skin tightening do you do. They've seen the EXION, they're invested in the device before they've even come through the door. But not only that, we have more press confirmed. These are some of the upcoming press coverage that we are going to be seeing over the coming months. They're in key publications. They're going to be building that buzz and continue to build that buzz, so more and more awareness is out there for this incredible device.
And our patients are more educated and informed more than ever now, because 5 years ago when I invested in the original M-Sculpt, it was the first generation muscle stimulation device to build muscle and simultaneously burn fat. And little was known about it at the time because it was just going through across the pond. So very similar now, and 5 years later with EXION, we now have so much marketing, we have so much buzz around all of the BTL platform, and it is now going all over the world. I was very honored to be invited to launch this at IMCAS in Paris with some highly esteemed KOLs from the States, and all of the clinical publications, all of the clinical studies have come from them. They've been working on this for a very, very long time. And I'm excited to take this across to Taiwan and to Australia and to Bangkok and all over the world. People are talking about this device. As the ribbon was cut at IMCAS a few weeks ago, not just 300 devices were anticipated to be sold globally, the number doubled, 600 all over the world, because people can recognize the amount of science, innovation, precision, data that has gone into the creation of this device. So I don't just stand
Very
here.
tight on questions.
Yes. So look, there is a lot that Sarah and I have covered here today. And it's because this is not just one platform. There are 4 beautiful, unique devices built into this platform. And we use it every single day. So we would love for you to come and join us at the BTL stand, where you can ask us all the questions that you want to, share a glass of champagne as we kick off the launch of EXION here in the UK. Sarah's going to be doing an exquisite demonstration on body. Is that right, Sarah?
Body, Alex and I will be taking body at 11:30. And then yourself, you're back at 12:30 with the fractional and the EXION face. And then not to miss out, tomorrow at 12:30, M-Face Submentum will be demonstrated, which is the newest technology that is coming from BTL. And we both have this in clinic and have just started, and wow. So they continue to innovate and continue to bring out. They listen as well. We have clients asking us about this with M-Face. Well, we can now treat it. So please do come down to the stand. We will be at 11. You can't miss us when you walk in, and we'll be there to answer any questions that you may have.
Wonderful.
Thank you so much.
Thank you.
Thank you.